thank you all. Whoops, thank you all for sticking around this long as well. I'm glad we didn't get into the long introductions like we did on some of our earlier speakers because, and you, Commissioner Donilon, mentioned that they're all in the booklet. But in the end, regardless of my fancy title and the fancy title that we all share up here, in the end, I'm just the guy from Tupelo, Mississippi, who's damn glad to be living in Louisiana again, where where for reasons we heard earlier today, I can say I'm proud to be from Louisiana. So. From what I learned, there were about 600 of us who registered today. About 400 are producers. And so when I heard that from the Commissioner's office, I said, well, who should I really be addressing? Should I be talking about how my business is changing, or should I be talking when I'm up here on this firing squad, I'm sorry, this panel, should I be talking about how this business is changing for the producers as well? So you'll see in some of my remarks today that I'm going to be talking about that, and they'll have a perspective on my opinion, Coventry Health's opinion, on how we need to be working together cooperatively and collaboratively as we change our business models as a result of healthcare reform, so that we all continue to have viable business models in 2014 and beyond, quite frankly. First, we've talked about this earlier today. We're all essentially waiting on the Supreme Court. And it's important to talk about what it's going to mean to us. We all know that. But a key thing I want to point out to you all is that the Supreme Court's decision is something that, that we're waiting on, allows us to, or means that we've got to be concerned about the continued unpredictability in terms of policy and political and legal environment. And how it affects our customers. I mean, even if the Republicans were to take the White House and the Senate, your customers and you need to be thinking about, and we need to be thinking about how to prepare for PPACA implementation, because full repeal is unlikely. You know, let's say this. Assume the PPACA stands at the Supreme Court and that the White House is taken, and the Senate is taken by the Republicans. The fact of the matter is, repeal is not going to happen because you've got to have 60 votes in the Senate, and nobody is going to have 60 votes in the Senate. So the message is, be prepared. We've got to go forward as if we're going to have to implement this. Notwithstanding the opinions and the facts and figures presented earlier today, we need to be prepared. You've all heard of scenario planning. This is the likely scenario, and we need to go forward with that attitude. And then finally, future reforms are inevitable beyond where we are today. And the reason for that is that health care is just too big a piece of the budget, and our debt issue is such that no one is going to ignore the size of the health care piece of pie when they say, where can we take money? Where can we get money? So be prepared for that as well. Now, all of you may be familiar with what I characterize as Murphy's Law of thermodynamics. And that is that everything gets worse under pressure. We are a house under pressure right now. The healthcare world is a house under pressure, whether you are a carrier represented by my peers here, whether you're a producer, whether you're an employer, or whether you're an individual purchaser. It's a house under pressure. There is so much going on, as you heard Rhonda and Glenn say. So much going on in our businesses, changing our business models. We are really under pressure inside our buildings, and yet we're still trying to maintain a business and keep it lively and going forward. We heard earlier Councilor Donald talk about the fact that you know, changing the definitions in the law concerning group size. Is small group going to be 50 or below first, or 100 and below, and whatever, and that there was some sort of agreement to not tax the carriers too much with these changing definitions. From my point of view, quite frankly, and the point of view of my team at Coventry Healthcare, everything in this law is taxing the carriers. Again, we are a house under pressure. We are going 100 miles an hour, and we're going 100 miles an hour going down several different scenarios. What if this happens? What if a portion of this has happened? What if the individual mandate gets struck down? What if the whole thing? We have to plan all of those scenarios because we are businesses, and whether you're a for-profit business or a not-for-profit business, you still have to maintain a business in a way that we have enough reserves to pay the claims for your customers. So the whole point is, it's a house under pressure, and a house under pressure, everything gets harder. Because everything gets harder, we've got to work together more closely than we have in the past. Some of these things have already been gone over. I'm not going to go over them. I'm happy to provide slides to anybody who wants them at the end of the day. But what this slide is it's just a reminder. If you read some of these little bullet points quickly, just pick any one or two. It's a reminder that there are other things that are happening every day in 2012, 2013, and 2014 that we're not necessarily paying attention to. These are littler things than the MLR, minimum MLR requirements that you heard Glenn talk about earlier, which is a monster thing for all of us, obviously. But there are little things going on. Pick the individual mandate coverage. Several of our speakers earlier today talked about, whether that's going to be struck down or not. Well, of course, the administration's position is if that individual mandate is struck down, that those next 2 points over on the right-hand side, if the individual, if the individual mandate is struck down, then those 2 points underneath it, and the battery doesn't work anymore on this, so the pre-existing conditions coverage issue and the community rating issue, those need to go by the wayside too, because as insurers running a business, if everybody's not required to be in the pool, we can't just pay for only the unhealthy people. Again, it's a house under pressure. A lot of change going on. I think you heard Congressman Cassidy talk about that topic as well earlier today. So some of the other components of 2014 and plus, and again, I encourage us all not to look just up to the exchanges at 2014, but just beyond, with the individual mandate. You heard earlier people talking about the minimum essential benefit coverage, and the individual mandate penalty. Well, the big debate there is the penalty big enough to really matter to anybody? And if it's not big enough to matter to anybody, are people really going to get in that pool as if they're healthy or not? You heard talk about the affordable minimum essential benefits. The plan cost overall has to be less than 9.5% of income for the individual or for the employer. So, there are a lot of things that are out there. Now, what are the individual minimum individual benefits? You heard them referred to earlier. You heard, I think it was Mr. Webb mention that there are 10 categories. Well, here are the 10 categories right here. And I think if you look at those, if you really take a moment to read all 10, there are some of them in which you have to ask yourself, what the hell is that? I mean, I think all of us can agree, we kind of have an idea what, for example, rehabilitative services are. We pay for rehabilitative services today. I think all the insurers do. But I'm not sure what habilitative services are. I know I'm going to rehabilitate you if you've had something happen. But your habilitative services, I'm not sure what that is. So somebody's got to give us some direction, but we still got to keep moving forward because we got to run a business. So multiple scenarios, a house under pressure, we have to keep moving. I think we heard Mr. Webb also say earlier that HHS has deferred to the states on these minimum essential benefits. We really have to take our hands around that issue and say, okay, let's define them. Uncertainty. Uncertainty is the name of the game, I think, right now. I wish we had more clarity from HHS. We're getting a little bit every day, but not enough so far to keep us going at the momentum pace we need to. We talked about insurance exchanges. A number of people have. I don't need to go over that. Taxes and fees that are going to be out here. I mean, the biggest question to me about the insurance exchanges is who can participate. We've already heard Louisiana is in a minority of states in terms of these insurance exchanges, but who can participate is something that I think really we need to be determining, and we shouldn't leave that up to the feds. Now, why are these, why are we looking at changes in the PPACA law bringing in all these consumers? Well, the reason is all of you have grown up, even the youngest of you have grown up in an American insurance system where we really just didn't pay attention. We didn't have to. We got our benefits from our employer, or you bought an individual policy. You knew how much the premium was, perhaps, and then you went out and you used the services whenever you needed them. You went to your internist, your OBGYN, you went to the emergency room if something really frightened you, but what did you pay? Well, some of you are as old as I am, you paid what we call an indemnity policy. You paid maybe 10% or 20% of the bill. But today, for the most part, that's not what happens. You pay even less. You're even further removed from what does this really cost us. But the consumer is going to be involved. You and I are going to be involved now, your customers, and we are going to educate ourselves. I'm not going to go see my internist anymore. I'm not going to go see my gastroenterologist and just go in the office. I want to know how much that colonoscopy that I'm so looking forward to is going to cost me. And I want the results. I want to know how many false positives do you have on your colonoscopies? And what are your infection rates post-colonoscopy or problem issues? I'm going to want to know those things. You can bet the consumer, just like when she buys that nice new 300 series BMW, she is going to educate herself about where she gets the best price and the car model she wants. And we've got to be prepared for that. Now, why is that important? It's important because of this. I think Glenn had a couple of numbers up here, and it's not important whether my numbers agree, Coventry's numbers agree with United. What's important is that number, let's see if I can get a little battery power right there. That green piece right there under the firm size of fewer than 50. The important number is that 26 million some odd people in that small group market are going to be going out into the exchange, making the choice on their own. And people don't tend to spend the kind of money our products and services cost without doing research. Now, they're going to need help doing that as well. Now, there's certainly some argument about whether it's going to be that many people. A lot of that depends on the employer environment in each market. And I'll give you an example from one of the other markets in which Coventry does business. Up in Pittsburgh, there is beginning to gel an opinion that really employers, these small group employers, are going to go out and do the buying in the exchanges, because they're going to continue to want to offer these plans because the labor environment in Pittsburgh is so competitive that these employers say, I've still got to offer this as a benefit. I can't just push the employees out. Here, take $1,000, go make your own decision. It's not going to work that way in Pittsburgh, people are beginning to think. So in Louisiana, I mean, we're a small group market for the most part of the state, and the north part of the state is even more so. That's a very important question for us, and a question we need to be asking your customers, the employers. What are you thinking about doing? It's very close. It's just less than a couple of years away. So here are the questions, or here are the options that those people have, that we and they have in 2014 going forward in the small group exchange. You can see them. I'm not going to read them all to you. You can stay in the exchange as an individual. You can stay in the exchange as a shop, meaning your employer is going to buy. The employer can opt for an ASO plan in much smaller group sizes than had been happening before. Or the employer can say, not offering. Head out to the exchange. That's why it's important. People are going to be left with these choices for the first time. Now, briefly on the exchanges again. There are basically three categories of exchanges. We fall into the last, obviously, and what I characterize as in denial. And I know there are people in the crowd who will say, you shouldn't call it that, Jay, but that's where we are. That's where we are. One thing you can be for sure, again, I think Mr. Webb mentioned this earlier. That's his name, right? Commissioner Donnelly, Mr. Webb? He mentioned earlier, I feel it was either he or Ms. Miller, if we let the feds design our exchange, it will not be tailored to Louisiana's market. That frightens me. Now, do I side with the governor in his position on not taking the money early on and saying we're going to defer to the feds? That's immaterial. I'm here to run a business. I'm here to meet the needs of customers. And if I'm meeting the needs of customers who are in Louisiana, then I need to be making the decisions, not the federal government. Here's where we are, by the way. The company we are in, again, we heard some information that might be slightly updated from this number that I have here, but here's where the states are in terms of who's doing what in state exchange activity. And you heard maybe a couple of dozen here. Again, Mr. Webb said that. But here's the last information I have. There are only 5 of us who have said, nope, we're deferring to the feds. This is one place where Mississippi, Secretary Greenstein mentioned earlier, of course, thank goodness for Mississippi. Well, this is one place where Mississippi is saying, thank goodness for Louisiana. You'll see that Mississippi, on both sides of the map there, Mississippi is in green. And green is highly focused on creating a state exchange. And again, I think hopefully Commissioner Donilon will have some information from his peers over in Mississippi about how this is looking over there. But everything I get anecdotally from our operations in Mississippi and from peers and other brokers that we work with over there is, gee, it appears that in Mississippi we're really going to be out front with an exchange. I don't know what that means. I don't know if the feds might have a better exchange than we might develop. But I'm concerned about the risk of leaving it in their hands. So what are some of the implications for your customers? First of all, you want your customers to avoid inadvertent penalties. So you have to help them understand what all this means. What does the individual mandate mean? What does the exchange pose for you? Second, understand that individual mandate, because those individuals are going to be going back to their employers, because that's the world we've grown up in. You've made all my decisions as my employer. I'm going to come back to you and I'm going to ask you questions about what it means for me to comply that I'm in this individual, I've bought individual coverage or not. To me, that spells opportunity for the producer community to keep that relationship with the employers so that you're providing that information. However you're providing it, whether you're doing it one-on-one in classes or whatever, but you're providing it and getting paid for it. I think we're going to see a lot more stress on the delivery system. And in Louisiana in particular, that stress is going to be the result of both the exchanges and the Medicaid expansion. I think what we can see in districts 1 and 2, where Medicaid is already rolled out, what we're seeing is a lot more people engaged in the system. That means the providers, the docs, are getting a lot more people knocking on their door wanting appointments. That's going to stress the provider system. And then finally, I think there's going to be even greater cost shifting to the commercial payers, just primarily because of the low provider reimbursement, future provider cuts, and Medicaid expansion. I won't go through this with you, but just read the purple boxes on the sides and you'll get an idea of what we're talking about here. And again, I'm happy to provide more detail on these if you'd like. But I think what we're going to see is we're going to see a bifurcated market. It's going to be a consumer-centric, largely individual small group market, and then there's going to be a large group market. But the small group market is a dinosaur at this point. That's the way it looks to me. Second, customers are driven by the value proposition. They're going to want to know how much this costs them and what's my outcome. Whether you're a broker, a producer, or a carrier, it doesn't matter. We need to have a clear, unambiguous value proposition for our continued customers. The government's going to be squeezed for resources. The debt and deficit crisis ultimately is going to lead to changes, and they're going to look at us. Healthcare, margin compression. Gosh, it just really peeves me that no other industry has these type of restrictions on it. It really is messing up my dadgum plans for the future, you know what I mean? I was hoping to have a much easier time of this. This is not going to be easy for any of us for the next 5 or 6 years. And Commissioner Donilon said 6 years, this is his life. You bet it is. It's going to take care of everything. It's going to take all of our time. I think we've got an economic hangover where jobs and revenues haven't yet recovered. We're going to see that. The tide of technology is going to continue, and how we reach out to these customers, especially the individuals, social media, web media, digital media, it's all going to be very important that we change the way we approach them. My own opinion is the high-performance network, the ACO model, is not going away this time like it did in the mid-'80s. I think it's here to stay, and primarily because it's going to be facilitated by the technology and the ability to capture information that we didn't have before. And then it's also, by the way, it's a jump ball, not just for these 4 carriers up here, but it's a jump ball for every producer in here. This is an opportunity in the next 2 years or so that you've got that says, make a new business model, make it work for you, make it viable to the consumer, meet the needs of the consumer, or you lost the jump ball. So I think in the end, large group, it's going to be stable. That's good news. Some of you have large group business. Small group, it's going to be tremendous change, and people are going to be moving to self-insured business like they've not moved before. Now, what are you all interested in? And I've been up here rambling for 10 minutes already. 400 of you are out there wondering, what is it where you're going to get paid? There we go. Exactly. How are we going to pay you? I think first, the MLR, minimum MLR requirement is not going away. I don't believe it's going to be thrown out, regardless of the House and the Senate bills. I'm talking about the U.S. House and Senate bills. I just don't think it's going to pass. There's just not support for it. So it's out there. Our business models, the carriers' business models, have been dramatically changed because of that. The producers are going to have to think, how do I fit into the business model of those carriers so that I can continue to deliver value and get paid for that value? I don't know the answer to that yet. It's a very difficult equation with the minimum MLR requirements and with producer compensation included in the premium number. And then third, I have to say this. Although it's as submitted, the bill now, House Bill 1032, does not include the language that I want to see in there, and quite frankly, that LAHP, the Louisiana Association of Health Plans, wants to see in there. I also act this year as the president of the Louisiana Association of Health Plans. It is not our intent to have the wording of that bill out there the way it is right now. It's clear that the producer comp model, the fee model, if you would call it that, doesn't work in groups of 10 and 20 and 30 and 40. But there's some point at which that model can work for all of us and for you, and I think we ought to try to reach agreements ultimately on where that point is, where that inflection point is, and move forward in our state with a bill and with laws that allow us to do that, allow you to do that, because I believe it provides you unknown before flexibility. It allows you to go on a one-by-one basis. If you want to produce with this guy, if you think you provide this customer tons of value and they recognize it, you ought to be wanting to go in there to negotiate a fee for that 75 or 100-man group. But if you want to go with a strict 4 or 5% commission, whatever the number is, you ought to have the flexibility to choose that on that employer. That's what I think what that bill ought to ultimately say. I want the producers to have the flexibility to choose either way they want to get paid. And then in the end, I think it allows you to capture value for services you really produce. I've seen a lot of the brokers we work with provide year in and year out throughout the year a lot of value that they don't get paid for in that 3 or 4 or 5% that we pay them. And I'd like to see you guys have a chance to recover that. Now, boil it down to this, and I'm closing with these few words. Number one, don't bet on the Supreme Court. It just isn't going to happen. Number two, consumerism is here in healthcare, and it is going to be a surge of consumerism followed by increasing momentum. Imagine if it were the first time you were going to be allowed to buy an automobile, how quickly you'd bone up on the information and how quickly you'd continue to do that as you traded, and you'd learn more and more and more. 10 years from now, we're going to look back on this and we're going to go, oh my gosh, I can't believe that family is making that decision with that information. Third, we are in a corner, the carriers, and it's a new corner. No other industry is like this. No one else has had limits put on it. There are no more good years and bad years for the carriers. Everybody understand that? There are only baseline years where we have hit the minimum MLR, or there are bad years when we've had lots of illness for whatever reason, lots of injury, and our MLR is higher than the minimum MLR requirement, which means it bites into our profit or our reserve set aside, however you want to look at it. So there are no more good years and bad years. In good years, it used to be we set aside a whole lot. We return to our shareholders, or if you're a mutual company, return to the owners of the company. But now it's you got to spend 80 or 85%, nothing less. And if you have a bad year when your MLR is 95 because there was an epidemic, because you had 50 liver transplants, because you had a whole bunch of accidents and things like that, that's just tough luck. Tough luck, carrier. Bad year for you. So that's a real issue, but it's not going away. We're in a corner. And then finally, I would argue, if you don't want a single-payer system, ultimately, you have to increase the flexibility in the consumer compensation or the producer compensation model. And I encourage us to look at that cooperatively and collaborate with each other, not butt heads with each other until we get through this legislative session so we can all go, we didn't have to do anything different. And then finally, you know, I will say this is a revolution out there, and this is a revolution that is not being televised. It's in our offices. It's very, very personal to each of us. We heard Ms. Miller say this morning, we're not extending the deadlines, or this afternoon. Many things are going to happen, but we ain't extending the deadlines. That's a real issue. The exchanges are coming. And the law of the battlefield says this: a good plan arrived at quickly and pursued vigorously is always better than a perfect plan arrived at late or executed poorly. And that's where we all are. I appreciate the time. Thank you.